I'm Dr. Wolf, CEO and founder of WOLFPACC. I'd like to take a moment and welcome you to our program. We are a USIMILE and COMLEX board preparation program, which takes material that you've learned in medical school through books, through online approach, and we show you the why. Now, many of you started off on a journey to become a doctor, and with the trials and tribulations that you've faced along the way, sometimes that goal seems a little further away. Here at the program, we specialize in that. But most important, in lecture, I'm never going to be that type of instructor that just reads off the slides. You can read, I can read. Why do we have to do that together? In lecture, we're going to sit and draw. Because when you visualize it, and we're all visual learners at some point, it helps you understand why. But more important, your patients expect you to understand why. Take a journey with me right now into the lecture hall and see how I teach.
That is a marker of GFR is creatinine. Creatinine we use to correlate to GFR.
Oh, so that's why you don't give metformin in renal failure or CKD.
Ding, 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 ding. Because what's going to go up, Raj, then?
Lactic acid.
You got it. And could that start to denature cells of the body?
Yes.
And could that also cause hydrogens to go into the cell, inducing a hyperkalemia?
Yes.
Oh, man. So what lab do we always measure before we prescribe metformin?
Lactate?
Creatinine.
Oh, no. EGF, kidney,
GFR.
renal function.
Correct. We always measure serum creatinine before you prescribe metformin. And each follow-up visit of a patient who's on metformin, what do we measure?
Creatinine clearance.
And if on a follow-up visit that creatinine is going up, what's your next step in management?
You start to
Stop that metformin immediately. That's why we do the creatinine. And that's so important because otherwise the lactic acid. But wait a second, hold on. Look at the picture at the bottom right. If I could come in here and dilate this, dilate the afferent side, right? Dilate the afferent side, what would that do to GFR?
Increase.
Increase it because I just dilated it, right?
Hmm.
That's so cool. Hey, you know who does that? Prostaglandins produced by the kidneys. They dilate the afferent arteriole, promoting GFR. That's cool. Hey, wait a second. So what would constrict that?
ready kind of.
What's that?
NSAIDs?
NSAIDs. Wait. Hold on a second. So you mean to tell me if I have a patient on metformin who now takes an NSAID, what's going to happen to their GFR?
It's going to decrease.
And what's going to happen to lactic acid levels?
They're going to increase.
That is how you get lactic acidosis on metformin.